Many women who undergo chemotherapy for breast cancer describe unsettling changes to their memory and concentration. Researchers at the University of Michigan Comprehensive Cancer Center say this phenomenon is very real, and have even given it a name, chemo brain.
When I started to feel funny in my head, I really didn't know what it was. I didn't know if it was a reaction to a trauma, being told that I had breast cancer. I really didn't know. It was in my late 50s. Was it the beginning of an aging symptom? Or was it the drugs that I was getting in terms of my chemotherapy?
Women have complained of cognitive changes that have occurred during the time that they've been treated for breast cancer for a long time now. And chemotherapy is one of the possible sources of these kind of cognitive changes. But actually, there are other possible reasons that a woman might experience cognitive problems. The term chemo brain has been coined, and this is used to describe the kinds of cognitive changes that seem to be associated with chemotherapy and involve the loss of concentration, difficulty remembering things, having difficulty thinking clearly, and not being able to function effectively in normal activities that the person was able to do perfectly well before they had treatment. The study that we are embarking on at the University of Michigan Comprehensive Cancer Center in collaboration with the Breast Care Center has two major aims. The first is for us to be able to see whether there are changes or alterations in brain function related to adjuvant chemotherapy for breast cancer. And the second is to see whether we can relate those changes that might occur to women's actual experiences of changes in attention and working memory and other cognitive changes that they report over time. Our ultimate goal and hope for this research is that it will give us information that will be a kind of basis or foundation for designing care or interventions that we can help women from the very beginning of their treatment, help them to maintain their cognitive function and to even conserve cognitive effort so that they can maintain optimal functioning over the course of their breast cancer treatment and beyond.